Hi, my name is Nick Haywood, and I'm a graduate student in the Masters of Athletic Training program here at AState. I want to start off by saying thank you to everyone who made this research poster happen. My research is on assessment of pre-participation injury risk factors in FBS intercollegiate football players. My mentor is Dr. Scott Bruce, as well as co-author, along with Dr. Robert Bradley and Dr. Carlita Moore. The purpose of this study was to determine if reaction time in both visuomotor and whole body reaction agility were predictors in sustaining lower extremity injuries in players of a Division I football bowl series, or FBS for short. There are approximately 36 injuries that occur for every 1,000 athletic exposures, and a leading cause for this is from poor body mechanics and control. There are prediction models that have examined the role of core muscular endurance and fatigue on musculoskeletal injuries to support this. However, there has been no injury prediction model to date that have looked at a Division I FBS football team. Visuomotor reaction time involves the central and peripheral vision and is the time it takes for a person to visually see a stimulus and the person to react to that stimulus. Whole body reaction agility is essentially the same thing, except the entire body is needed to react and move. In our study, there was a total of 102 Division I players baseline tested during the preseason. In total, there were 7 tests, 3 tests used on a light board, known as the reflection edge, and 4 tests done on a separate device known as the tracer. The reflection edge captured the athlete's visuomotor reaction time on an LED touchscreen light board, and the tracer tested their whole body reaction agility with a monitor and a video camera. The 3 tests used for the reflection edge were Big G, Go No Go, and right and left execution, or RAIL for short. Big G tested true reaction time and accuracy. In Go No Go, the athlete placed their fingers on a home base and were told only to touch their green boxes and not the red boxes. The last test, RAIL, would ask the athlete to touch purple boxes with their right hand and touch yellow boxes with their left hand in order to test right and left hand reaction time. The 4 tracer tests were lateral agility, lateral flanker, diagonal agility, and diagonal flanker. On the monitor, the athlete sees an avatar of themselves and where virtual bumpers appear on the screen and then have to move to the bumper to make them disappear. The lateral agility test is where the athlete would move to their left or right depending on where the bumper was and return to the starting point. The diagonal agility is the same, except they move backwards, right or left diagonally. Both of the flanker tests would have 5 arrows on the top of the screen, and the athlete would move the direction the center arrow was pointing. Sometimes the arrow would be pointing with the other 4, and the other times the arrow would be pointing the opposite way. The athlete would need to see the middle arrow and determine the direction it was pointing before they would disappear on the screen. The flanker tests are similar to the agility tests, except a bumper appears on both sides of the athlete. All of the baseline data from these test batteries were gathered and used to create a prediction model for who is at high risk for musculoskeletal injuries. During the preseason and 12-game regular season, lower extremity musculoskeletal injuries were counted for the model after the season had ended. Linear and logistic regressions reduce the original 102 variables to the final 3-factor prediction model. The multivariable prediction model was derived from a series of analyses for determining relative predictive power of the variables. The interaction effects of the predictors were assessed in 3 ways. The first was graphic representation of the interaction between 2 predictors. The second was combining predictors and examining through a 2x2 cross-tabulation table. And the third was calculating the Mantel-Hansel common odds ratio. Our final 3 factors were Big G average reaction time, lateral agility maximum acceleration, and diagonal flanker speed asymmetry. Asymmetry is the difference between the speed going to the right versus going to the left. The optimal cut point via ROC analysis found greater than or equal to 2 predictors, meaning the odds ratio for a player with any combination of the 2 or more predictors had 14 times greater odds of suffering a musculoskeletal injury compared to someone with less than 2 predictors. The clinical relevance of our results demonstrated both whole body reactive agility and visuomotor reaction time are predictors for musculoskeletal injury for Division I football players. We acknowledge the specific factors and their cut points may differ from team to team. This method of data analysis identifies those who are at high risk for injury and allow athletic trainers to implement a remedial program to prevent future injuries. And that is my research poster. I hope all of you enjoyed it, and thank you all for your time.